Cardiac arrest is a very serious medical emergency. It happens when the heart suddenly stops pumping blood like it should. Unlike a heart attack, which happens because of a blockage in a blood vessel in the heart, cardiac arrest is an electrical problem in the heart. This problem stops the heart from pumping blood to important parts of the body. If a person doesn't get help right away, cardiac arrest can kill them in minutes. Knowing the signs of cardiac arrest and what to do is really important for saving lives. Cardiac arrest is when the heart suddenly stops working. It happens because of problems with the electrical signals that control the heart's rhythm. When this happens, blood stops flowing to the brain, lungs, and other important parts of the body. The most common reason for cardiac arrest is a heart rhythm problem called ventricular fibrillation. This is when the heart quivers or shakes instead of pumping blood. Other things that can cause cardiac arrest are a bad heart attack, a heart muscle problem called cardiomyopathy, or even heart problems a person is born with. Cardiac arrest can happen to anyone, but it's more common in people who already have heart problems. Unlike some health problems that happen slowly over time, cardiac arrest happens all of a sudden, often without any warning. It's super important to know the signs of cardiac arrest because every second counts when you're trying to save someone's life. Here are the most important signs. 1. Sudden loss of consciousness. Someone having a cardiac arrest will pass out suddenly without any warning. They won't respond to you and won't move. 2. No pulse. When someone's heart stops beating right, you won't feel a pulse when you check their wrist or neck. 3. No breathing or weird breathing. The person might stop breathing completely, or they might take short, irregular breaths. 4. Chest pain or discomfort. Sometimes, some people might have really bad chest pain right before their heart stops. 5. Dizziness or lightheadedness. Right before cardiac arrest, someone might feel dizzy or lightheaded because their brain isn't getting enough blood. 6. Fainting. A lot of people faint right when cardiac arrest happens. 7. Fatigue or weakness, not always. Sometimes people feel really tired or weak right before cardiac arrest. You might not always feel anything different before a cardiac arrest, but if you feel any of these things, you should be careful. 1. Palpitations or irregular heartbeats. If your heart feels like it's racing, fluttering, or skipping beats, it could be a sign. If your heart is beating strangely for no reason, call a doctor right away. 2. Chest pain or discomfort. Chest pain is usually a sign of a heart attack, but it could also mean cardiac arrest is coming. The pain might spread to your arms, jaw, neck, or back. 3. Shortness of breath. If you have trouble breathing, even when you're sitting down, it could mean your heart isn't pumping blood right. 4. Unexplained sweating. If you're sweating a lot and feel dizzy or sick to your stomach, it could be a problem with your heart. 5. Feeling of impending doom. Some people just feel like something really bad is going to happen right before a cardiac arrest. 6. Unexplained fatigue. If you're always tired or suddenly feel very weak for no reason, it could be a sign of heart trouble. If you or someone you know has these symptoms, call 911 right away. When someone has a cardiac arrest, their heart stops pumping blood. This means their brain and other organs don't get the oxygen they need. After just 4 to 6 minutes, their brain can start to get damaged and they could die soon after. Doing something right away, like CPR, that's cardiopulmonary resuscitation, or using an AED, that's an automated external defibrillator, can really increase the chances of someone surviving. If you think someone is having a cardiac arrest, do these things. First, call 911. Call for help right away. Second, start CPR. Push down on their chest 100 to 120 times every minute. Push hard and fast in the middle of their chest. Third, use an AED if you can find one. An AED can give their heart a shock to try to get it beating normally again. Just follow the instructions on the AED. Even though cardiac arrest can happen out of nowhere, some things make it more likely heart attack. If the blood vessels in your heart are blocked, it can mess up your heart's rhythm and cause cardiac arrest. Arrhythmias. These are problems with your heart's rhythm, and they're the most common cause of cardiac arrest. Cardiomyopathy. This is when the muscles in your heart are too thick or too weak, and it can stop your heart from working right. Congenital heart defects. These are heart problems people are born with, and they can sometimes cause cardiac arrest. Severe blood loss or shock. If you lose a lot of blood or your body goes into shock, it can make your heart stop. Things like smoking, Being overweight and not exercising enough can also make heart problems more likely. We can't always stop cardiac arrest from happening, but we can do things to make it less likely. 1. Live a healthy life. Eat good food, exercise a lot, and don't smoke. 2. Take care of any health problems you have. Make sure your blood pressure, diabetes, and cholesterol are under control. 3. Keep moving. Being active makes your heart stronger and helps your blood flow better. 4. Get regular checkups. See your doctor for checkups so they can find any heart problems early. 5. Know your family history. If people in your family have heart problems, you might be more likely to have them too. Cardiac arrest is really serious and can kill someone if they don't get help right away. Knowing the signs, like someone passing out, not having a pulse, and breathing weird, can save their life. We can all learn about heart problems and how to prevent them. That way we can help ourselves and the people around us have healthier hearts. If you ever see someone pass out suddenly, call 911 and do something to help. Every second counts.